Good morning, and thank you for being here. Welcome to Red Cross St. Martin First Aid Awareness Campaign and AUC Stop the Bleed. Welcome, and thank you for coming to our live presentation. And I would like to also welcome our online viewers. Today is edition number 3. We look forward that you will enjoy our presentation and also stop the bleed. Today you will be experiencing our own Red Cross and Martin first aid instructor, Meredith Concepcion. She will be instructing you and showcasing to how to solve, how to experience, and how to help someone when they are partially obstructed and they cannot breathe. You will also experience how to do CPR and how to use the AED machine. We welcome you and thank you, and we hope you enjoy and have an experience that you'll never forget. And we also want to let you know that you can follow us at Facebook, St. Martin Red Cross, and also on our Facebook page. And we hope you enjoy the first session of Stop the Bleed and AUC and St. Martin Red Cross combining together doing this for the public and the citizens of St. Martin. Thank you.
Good morning, each and every one of you. My name is Meredith Concepcion, and I am a certified European Red Cross instructor. Our third episode will be, as Esther said, choking. In our second episode, we discussed the CPR, cardiopulmonary resuscitation, and how to use an AED, the automatic external defibrillator. Today, we will be focusing on choking, mild choking, and severe choking. There are several reasons why a person can choke. Number one is trying to swallow large pieces or poorly chewed food, eating while talking, laughing, or eating too fast, walking, playing, or running with food or foreign object in their mouth, mostly with children. The food or object can end up in the windpipe, and the airway is then no longer clear. The signs and symptoms of choking may vary according to the severity of the obstruction and the object itself. The foreign object might partially or fully obstruct the airway. If the airway is partially obstructed, the victim will still cough, breathe, and grab their throat. If the airway is completely obstructed, the victim will grab their throat, cough without making any noise, cannot talk, can barely breathe or not at all, and will turn blue in the face and ultimately can lose consciousness. This is a life-threatening situation. This causes panic and anxiety. Partly obstructed airway. When helping a person that has a partly obstructed airway, observation is very important. What do you see? The victim can speak, cough, and breathe. Based on what you see or observe, you can then determine what to do. What should you do when a person's airway is partly obstructed? Encourage the person to continue coughing. A spontaneous cough is more effective, powerful, and safer than any action taken by a responder. Stay calm, remain checking for normal breathing as you encourage coughing. Fully obstructed airway. What do you see? The victim is conscious, cannot speak, is coughing, or cannot breathe. The victim is panicking and trying to catch their breath. The victim starting to discolor, looking blue or looking pale. What should you do? Call the ambulance or ask a bystander to call the ambulance? Stand slightly to the side, the back of the person who is choking. Put your arms around them, over their shoulder, and bend them over 90 degrees. Give 5 back blows between the shoulder blades to check if the object, then check to see if the object comes out. If not, then you clench your fists, place it right above your belly button, resting the thumb part on the person's belly, and put the other hand on that fist and give 5 abdominal inward upward strokes. Inward upward strokes. After giving the 5 abdominal thrusts, you check to see if the object came out. If it did not come out, then you alternate between the 5 back blow and the 5 abdominal thrust until the airway is clear. If the object comes out, the victim might still have trouble swallowing or continue to feel as if there is something in the throat. The organ may also be damaged by the thrust. A doctor must always examine the victim after the incident. If the object do not come out and the victim lose consciousness, lay them carefully on the floor and start CPR. If a pregnant woman is choking, instead of giving abdominal thrusts, you give 5 chest thrusts. So you will not be able to reach around her belly. If an infant is choking, you lay them on your arm and you gave 5 back blows and 5 chest compression with 2 fingers. If a small child is choking, you kneel behind the child depending on how tall the child is and give 5 back blows and 5 abdominal thrusts. Self-administered abdominal thrust. If you are choking and there is no one around you, lean over on the back of a chair or on a hard surface and you can give yourself abdominal thrust. Remember, always ask permission to help and get consent. Remember to always call the ambulance or ask bystanders to call. Stay calm at all times. We will now demonstrate partially choking and full obstructed airway. A person is in the restaurant sitting, eating and drinking, and all of a sudden was laughing with friends and started choking. A first aider, someone that did first aid, saw what is happening and came to help. She observed the scene is safe, to introduce herself and ask for consent. Partially coughing, the first aider encouraged the person to continue coughing. Okay, the object is out. Ah, it's out. Very good. you would see where the airway is fully obstructed. The victim is eating again in a restaurant, drinking, talking with her friends, and laughing. And all of a sudden, they started choking. But this time, it's more extreme. The first aider saw what is happening, surveyed the scene. The scene is clear. She called the ambulance. She asked for the bystander to call the ambulance. And she noticed that if nothing is happening, she'd go in the back of the victim and give 5 back blows. She looked to see if the object is out, came out. The object did not came out, but she gave 5 abdominal thrusts. She positioned her hand right above the navel and gave 5 abdominal thrusts. Inward, upward stroke. Inward, upward stroke. 5 abdominal thrusts. Object is still there. You check to see if anything came out. Nothing came out. She goes back and she gave 5 back blows. All of a sudden, what happened is that the victim lost consciousness and fell to the ground. The first aider rests the victim on the floor and immediately starts the CPR. The AD machine has arrived, 30 compression, and the AD machine has arrived. The first aider then yeah, ambulance is on the way. Everyone stand clear. Analyzing. Shock delivered. Shock delivered. Start CPR. Thank you. Okay. Stay calm. Get responsiveness.
Thank you. Good morning. I hope you guys enjoyed our session of choking, and we look forward to um, seeing you in our next session. Thank you.
Thank you to everyone who made this event possible. My name is Victoria DiCholio, and I'm the president of the Student Government Association for the American University of the Caribbean School of Medicine. Today, my colleagues and I will be presenting on Stop the Bleed and tourniquet usage. At this time, I would like to invite Courtney to the podium to start the presentation.
Good morning, everybody.
Today we're going to be giving a presentation on Stop the Bleed, and so be training you guys on how to potentially save a life in the future. So Stop the Bleed is an educational program that represents the joint effort of many organizations. So we have the American College of Surgeons Committee on Trauma, the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, and then the Committee on Tactical Combat and Casualty Care. And just a warning, some of the images shown during this presentation may be disturbing to some people. All right, so why do you need this training? The number one cause of preventable death after an injury is bleeding. And where can you use this training? You can use this pretty much anywhere. In recent news, mass shootings have currently received a lot of attention, but actually serious bleeding is more likely to result in your everyday life. So the goals of this training is to, one, identify and recognize the life-threatening bleeding, and then two, to stop the bleed, and taking steps to stop the bleed with pressure, packing, and tourniquets.
One of the most important things to keep in mind is your personal safety in these situations. So just like ACLS training or any other emergency situation, you have to make sure that the scene is safe for you prior. If the scene is not safe, try to move to an area that will be more safe. You can take the patient or the victim with you, please try, but again, do not jeopardize your own safety. It has to be your first priority, not only in the situation, but also protecting yourself from blood in this situation. So please wear gloves whenever possible and clean blood from you if ever on you when possible. If you do get blood on you, please report it to a healthcare professional once you are at the hospital so that proper steps can be taken to ensure your safety as well as the patient. The steps, so ABC, always remember to first alert 911. This is a situation in which you need to make sure that you dictate to somebody to call 911. There's often the misconception that somebody has already done it. Please be sure to instruct properly. And then bleeding and compression. So again, first step, alert 911 to get help on the way. Know your location and give as much information as you possibly can and follow instructions given by the operators. Bleeding. So for the bleeding, just be sure to find the source. So don't be distracted by the first one you see. Be aware that there may be other areas of trauma. This can often be hidden by clothing, so make sure to expose the patient as much as possible to make sure that you are finding all options of bleeding that may be present. Again, there may be multiple locations, so take time to ensure that you are not missing any life-threatening injuries. Some common areas, extremities, and this is likely where you're going to be using your tourniquet if the wound is severe enough. There are also transitional areas such as the neck and the armpit and the groin where we will not be using tourniquets, and they can also be on the body, including internal bleeding, which you may not see.
All right, now that you alerted the 911 and located the bleeding, now what you want to do is start compression. So there's some techniques, and I'm going to talk about two. Putting pressure on the wound. So first, if the wound is superficial and it's not too deep, you can get a piece of cloth or gauze or anything that's going to soak up the blood and just put on the wound and keep pressure. You don't want the cloth to be too big where you don't see how much, if the bleeding has stopped or not. So you just want enough piece of cloth or gauze to put on the wound and keep pressure. Um, and we have a video. And you would want to keep pressure until the bleeding stops. So just keep pressure until first aid comes, first responder comes. And then second method that I'm going to talk about is packing. That's for the wound that's deeper. So this is where the deeper vessels could be ruptured, and the pressure itself on the wound will not be enough to stop the bleeding. So for the deeper wounds, what you have to do is get a piece of cloth again or gauze, um, and then you would stick it in the wound. So what you want to do is you want to stick the piece of cloth into the wound um, in the direction of to the heart. So basically, if you're having it on your arm, there's a wound right here. You would try to stick it in this way towards the heart. Also, yeah. So this one also, you just want to keep pressure on it until the bleeding stops. And we also have a video for this one. Yeah, I know that it looks really painful. If that was actual wound, but that's gonna save his or her life. So the wound can be on extremities or junctional areas like armpit and groin area, as well as the body. So packing you can do basically anywhere, and I believe for the body area where it's abdominal or thoracic cage, you would want to prevent it because it could cause a lot of complications such as infection and difficulty breathing. But extremities, you can do it compression or, I mean, packing or pressure depending on the severity of the wound.
Morning. So now I'm going to talk to you guys about compression or after compression, which is the tourniquet use. So this is after direct pressure has not worked and after you pack and there's still significant bleeding that's going on. Um, so like I said, tourniquet's going to be the next option. You always want to start least invasive up to most invasive, which is the tourniquet at this point. Um, Usually we go by the 2-inch rule when you're applying a tourniquet. You're going to apply it 2 inches above the site. So say you're bleeding right here, you are going to apply 2 inches right above it. If you don't know what 2 inches looks like, you can use the tourniquet itself, kind of like guide you to where you're going to start. So you're going to put the tourniquet right above the injury, and where it marks the other side, that's where you'll move it up to, and that's where you're going to start applying. Um, do not um, do not place it right above or on the elbow or the wrist, the knee, or the ankle. So any point or any part of the body that has a pointy um, bone, you're not going to place it over. So if the injury is right next to the elbow, you're going to put it up just a little bit higher than the elbow. Just, you don't want to put it right where anything moves. So if it's able to move, don't put the tourniquet on it, just put it above that. Again, follow the 2-inch rule. You're going to start tightening it, and and you're just going to keep going until it stops bleeding. Once it stops bleeding, that's how you know it's tight enough. You don't want to go and overdo it. You don't want to underdo it. Um, and once you apply tourniquet, you're going to keep it there. You're not going to take it off. The patient's going to be hurting. Um, Tourniquets are not meant to be comfort or anything like that. They're meant to save the life. To just, make the patient aware that it is going to hurt when you apply this tourniquet. But the way I see it, it's better to have a patient that's screaming at you that it hurts versus a patient that's not, because that means that they passed away due to blood loss. So again, with tourniquets, you also need to keep in mind that it might be you on yourself that you had to apply it. This could be, you're in a car by yourself and you get into a car accident in the middle of nowhere and you start bleeding. You had to be able to apply it to yourself. Um, you can apply it over clothing, but there's a catch with that. You say someone's up at the ski hill, snowboarding or skiing, and they have big fluffy jackets on or the big snow pants on. You're not going to be able to apply it on that. That's too much clothing, which kind of defeats the purpose of having a tourniquet. Usually when there's bulky clothing involved, you want to remove that in order to be as close as you can to the skin. Let's say it's like yoga pants or something like that where they're super thin, or swimsuit. Um, you can apply it over that. And you always want to keep your patients as modest as they can, so you don't want to remove too much clothing. And like I said, they're gonna hurt. Tourniquets are not meant to make you feel better. They're gonna hurt, but they're meant to save your life. It's better, like I keep saying, it's better to have a patient who is in pain and angry at you than a patient that's not, because if they're not, then the tourniquet didn't work and they sadly passed away. Sometimes, depending on where the bleed is, you might require a second tourniquet. You can only tie in the tourniquet up to a certain point, and after that, you can't really tie it anymore. If that's the case, then bring on a second tourniquet if you have one. Next, we have a video. And here, as you guys can see, you see the proper application of the tourniquet. They're assuming that the injury is 2 inches below where they're applying it. They're going to loop through uh, um, the back of the tourniquet. And when you're looping, you're going to make it as tight as you can. So that's where you already start applying pressure. Just pull on it, make it tight. Next, there's a rod on those tourniquets that you start spinning. And that's going to tighten it even more. So you keep tying it until the bleeding stops, until you see no more blood coming out of the injury. Once that's done, you're going to clip it into the clip that is on the tourniquet itself. Tie in the rest of the tourniquet, and usually they're going to write the time on the tourniquet. From past experiences, as an EMT, I find that sometimes there'll be blood that's covering, gets everywhere. So usually you can just write the time right above the tourniquet, then make sure you always write the time. Another place that's really good to write it is on their forehead. Why? Because a doctor is going to see that. When they get into the ER, they're going to quickly see that there's writing on there. Most doctors are going to know that there's a tourniquet someplace. Last thing you want is, everybody in the emergency room or someone forget that there's a tourniquet on. Because if they're not bleeding anymore, they're not really going to, be focused on that injury. They're going to be looking at something else. So you want to make sure that everybody knows that there's a tourniquet on this patient. So that might be, by telling the EMTs where you place it and what time you place it at. That's why you write it right above where you place. So you write the time and then you write on the forehead. That way no one ever forgets that there's a tourniquet on that person. Here you see different types of tourniquets. Usually the center ones that you're going to see are the combat tourniquets, which are the ones that you saw in the video. Everybody here that's participating probably will receive a tourniquet so they can use and practice with. That way you get familiar with the tourniquet. There's quite a bit of different ones that you guys can purchase at any point. Just make sure that when you do purchase one, you know how to use it. So pull it out, put it on yourself, practice on someone else, get to know the equipment, because if you actually need to use it in real life, you want to make sure you know how to do it quickly and fast. Last thing you want is to show up on an emergency and have to pull out the manual on how to use that tourniquet, because that's going to be wasting time. Here's another list that the Stop the Bleed organization has deemed appropriate to use. These are just different names of them. You guys are able to go onto the website and actually purchase them if you would like. Like I said, these are just a bunch of names of the same things that they do. Finally, these are a bit different. These are, if you guys have ever gone to the doctor's office and when they check your blood pressure, that they puff up the cup. Usually that's how these work. You don't tighten anything, you just start pumping air into it and it tightens it on itself. These are not really seen much in the civilian world. They're seen on specific places.
So for bleeding in children, everyone, all the little kids are able to use a tourniquet except for the extremely young because their bodies might be too small for the tourniquets. So in their cases, you would just pack their wounds and hold tight. But for tourniquets, yeah, the bleeding in the child is very similar to what was presented for the adult. So the tourniquet and packing is acceptable. So some questions, if you have an impaled object, you do not want to remove the object, you just would like to place the tourniquet around the object. Then improvised tourniquets, there is no scientific data that improvised tourniquets are equal to a real tourniquet. So just remember to pack the wound, hold compression, loss of an arm or a leg. So ideally, we would like to try our best to save the arm or the leg. So applying the tourniquet, holding the pressure, stopping the bleed. It is very painful. So the patient might be screaming and yelling, complaining about how much it hurts. But just reassure them that the tourniquet will help them lose the least amount of blood. So and it will be better for them because you would rather want to lose a limb than to lose your life. So are there any other questions? So just to summarize everything, you want to make sure you are personally safe, make sure the area is okay before you get involved, because one patient is enough. If you're hurt, you can't help the patient. So A, alert 911. B, find the bleeding. C, compress, and compress with the tourniquet. So remember the ABC. And for more information, you can go to stopthebleed.org. They have a bunch of resources and a lot of information about becoming instructors. So with this training, you can now save some lives. Thank you.
So one final thing, we are going to bring up someone to demonstrate on how to apply a tourniquet. Okay, so here we have Noah, who's going to demonstrate on his mom. This is to show how easy anybody can apply a tourniquet. Noah, how old are you? So he's 11 years old. Let's see if he knows how to apply the tourniquet from the training that he's received. So first he's going to identify where he's bleeding. Okay, what's the next step he's going to do? Perfect. So 2 to 3 inches above where the injury is at. And as you can see, he's identified the site of injury. He's identified where he's going to place the tourniquet. And now that he's pulling, he's going to pull hard and already apply enough pressure on there. And now he's going to start tying even more with the rod that's attached to it. He tightens it until the bleeding has stopped. And he'll continue to wrap around the rod. And then after that, all he would do is write the time and wait for responders or EMTs to show up. Once they show up, he would tell them that he's applied a tourniquet and the time he applied the tourniquet. Thank you guys. So just remember the steps that we went through. First, you're going to look for scene safety. Make sure your scene is safe. You don't want to be a second victim on a car crash or anything like that. Next, you guys are going to identify where the bleeding is coming from. So on the mannequin arms, pick a spot and assume that's where the bleeding is from. Remember, your initial step is you're going to want to apply pressure. You apply pressure by doing the two-hand technique, where you grab a t-shirt, you grab anything that's around you that's you're able to, and you're going to apply it on there, and then you're going to use the two-hand technique, which is 1, 2, kind of like if you were doing a chart, and you're going to push hard on it. After that, if that doesn't work, then you're going to move on to packing the wound, and that's when you would take gauze or anything sterile, just because you are putting it into their body. So make sure, if you have gauze, great, use that. If you don't, use what you can. And that's when you would start packing it in. You would pack it in. You don't want to force it in. Just keep slightly, putting a little bit of pressure for it to go in. Once it doesn't go anymore, then apply pressure after that. If that doesn't work, that's when you move on to actually applying the tourniquet. So remember the rule. You want it 2 inches above the injury. So identify where the injury is at, measure 2 inches above it, and make sure it's not above the elbow, the knee, anything that moves. So if it's the wrist, make sure it's above 2 inches. If it's the elbow, 2 inches above that, the knee or the ankle. Once you identify the area, you are going to wrap around and tighten it as you're wrapping it through the loop. After that, you're going to take the rod and start twisting it until there's no more bleeding that comes through. Once that happens, you're going to lock it into place. You're going to put over the white tape on there, and from there, you're going to write the time that you apply this tourniquet. Then remember, just write on their forehead. It makes it easy for everybody to know that there's a tourniquet on this patient at somewhere in their body. And as you can see, we have some of our students here that are assisting you guys. So if you guys have any questions, please don't hesitate to ask us. And once you're comfortable practicing on the mannequin, I do want to see you guys practice on yourself. That way you know how to do it in case you are the victim at any point. And for those that are participating in today's course, you guys are going to be receiving a certificate for Stop the Bleed for completing this course with us, which is the presentation we had and the hands-on training that you guys are currently doing. And it looks like you guys are all doing great. Like I said, I do want you guys to practice on yourself to demonstrate that you're able to apply it in the event you were alone and you had a bleeding injury on any point of your body.
of the packing. So you could try it and try and get as much of this inside and then just apply pressure. And just hold it. Yep. That's how you pack.
And hope emergency service comes.
Emergency service comes
fast.
soon.
Yeah.
So, yeah, you want to practice. So this is before you get to the clinic. So in the case that like your patient just I don't know, let's say they got a tree stuck it out, but the branch fell out. So they just have a hole in it. So say you have a t-shirt on you. I would take my shirt off, bunch it up like this, and pack the wound. So when you're packing the wound, you want to make sure that this packing gets all the way up. You want to push it in and up. So you can go ahead and try, and then you can apply pressure to help rise.
Gonna kill.
Yeah. You don't want to make the whole picture. Yeah. Perfect. No more blood.
That's for sure.
So yeah, there's a lot of things to an emergency situation. We're talking about if you don't have a tourniquet, because most people don't carry tourniquets for fun. So say it's like this is I'm wearing a bandana, and I on the beach or whatever. Yeah. And you can make a tourniquet. So basically, what you can do is just like make it as long as you could, and then so their bleeding is whole. We're gonna want to put the tourniquet closer to the body, whereas we don't want to put the tourniquet further from the hole because it's still bleed. So we can make our own little tourniquet. Depending on how big it is. And you could just like tie it as tight as you can. And it's probably still be fitting because it's not like the best tourniquet. Yeah. So there's that one. Yeah, anything can happen in an emergency. You have to be prepared for everything. All the time. So, yeah. You want to practice putting a tourniquet on me? I would probably try.
If he does it, definitely.
Yeah. For sure. All right.
Good morning. Welcome back. We truly hope you enjoyed today's third edition. We also hope that this has triggered your interest and you want to learn and get more information on this. So Red Cross and Martin would like to let you know that we will be offering first aid courses, and this will be available on our St. Martin Red Cross website. This registration form will be available as of November 1st. We would like to thank all of our first aid victims, which was me, and our first aid instructors. I would like to call them up on the stage. Meredith, would you join us? And also, I would like to call our AUC candidate medical students. And I would like to let the public know that on October the 30th, our fourth edition will be live It will be at Red Cross Base at Airport Road number 34. I would like to also call our youngest Stop the Bleed to come up on stage. And I'll also invite our chair lady, Nadia Charlize. Please come up on the stage. And I'd like to thank Dr. David Adelstein. I don't see him here in the auditorium. Oh, come on down, Doc. And also Dr. Natalie Humphrey. We'd like to let our viewers know all of the participants here will be receiving a certificate on Stop the Bleed today. This is our team. Thank you very much for today's instructions. And we would love to let everyone know that the 30th of October might be our last edition. That is something still we have to discuss with Dr. Humphrey and our chairlady, Ms. Nadia. But for now, October 30th will be our last. But we hope you enjoyed it and welcome. And we hope that you stay tuned to us and follow us on Facebook and our website, Red Cross St. Martin. Thank you. Enjoy your weekend and stay safe. Thank you. Don't forget to sign up. Out. Someone go. She's choking, go.